This video is going to take a look at entering HML assessments into CareManager. We're not going to go into too much detail in terms of the HML questions themselves, but if you have questions on the purpose of HML, the questions about the questions on the HML assessments, or the requirements for supporting documentation, we do have a recorded training on our website that goes over HML in far more detail. But today we'll look mostly at the functionality in CareManager. So I'm here in the UAT, I'm in my test clients chart here, and first thing I'm going to do is navigate to the Assessments tab where the HML assessment lives. Much like everything else, I'm going to click the New Assessment. It's a very long list here. It's not this long in the live environment, but I'm going to scroll down till I see the HML billing questionnaire and just click on that. When it opens, it's going to populate the date automatically of the assessment, and it's going to go chronologically, and it's not going to allow you to skip any months. So in this case, this member enrolled in June, so it's looking for June to be my first HML assessment. Whether or not I bill for June, I can't move on to do July's until I do June's, so you'll have to do every one, and you'll have to do them in order. You won't be able to change these dates at all. First is draft or final. I will say that many staff have gotten into the habit of doing their HML assessments right after they do their billable core service for the month. So once you get one billable in and you've documented it, just go over, do your HML assessment and leave it in draft. I think that's a really good practice. That way you're not saving all your HML entry for the end of the month. And this way too, you leave it in draft because, as you probably know, on the HML, there are questions like, was the member discharged from an inpatient stay? Are they homeless? Things can change throughout the month. So if I'm doing this on, the first of the month or early in June, I want to leave it in draft in case the member does experience one of those events that I want to add to HML. For today's purpose, though, I'm just going to put this into final status just so I can save it and won't forget. The primary diagnosis is pulled over from your problems tab. So whatever you would enter it as primary is going to pull in here. In the questions themselves, first it's going to ask if you provided a core service. In this case, I did, and I'm going to enter the date of that core service in here. If you did more than one core service in the month, just pick any date of any of those. It doesn't matter which one. The system is looking to make sure you have a note finalized. It's not going to be cross-referencing the dates or looking for a specific one. The next one is about the chronic conditions. So this is a list from New York State of some of the chronic conditions that qualify someone for health home. You can pick multiple. You can't pick more than 8, as it says in the instructions here. If I had a single qualifier, I would maybe just select that one. One question I get a lot is, what about members who qualify for multiple mental health, right? So you can have multiple mental health conditions that qualify you for the program. Maybe none of them rise to the level of an SPMI. In those cases, because if you just pick mental health, it's going to look for a second one. What we recommend is you select other, and then in the box that populates, you can write 2 mental health conditions. The limitation of the system and the state options, but that's what we do. Again, if you have someone who's qualified solely for mental health conditions that do not rise to the level of a single qualifier. From here, questions 3 through 8 here get into some events and circumstances of the member. If you say yes to any of these questions 3 through 8, you must have supporting documentation on file to support your answer here. So if my member is HIV positive, I can say yes, but then I have to have something uploaded into CareManager that shows that HIV diagnosis. Hopefully that will also show their viral load and T-cell count, and I would enter those in whatever is on the labs. There is an option for unknown, so if you don't know, you can select that. But again, if you're working with someone who's HIV positive, we want to probably be monitoring those labs and communicating and coordinating with those providers. So it'd be helpful to get that information over time. But if you don't have it right away, again, you can select unknown. Same thing with homelessness. If I say yes here, I'm going to be asked if it's category 1 or category 2 HUD homelessness. If I select no, I'm going to be asked if they were recently homeless or housed in the past 6 months. If I say yes, they were housed in the past 6 months, I'm going to be asked to put in the date. Incarceration, similar. I don't know why they're all in here twice. It's only one in the live environment. If I say no, I just move on to the next question. If I say yes, I'm going to be asked to put the date in here. One thing, a lot of these have a date unknown option. Again, we are required to have supporting documentation uploaded to show that these positive responses on 3 through 8 are verified by an external source. So if you have your uploaded documentation, you should have the date on there. So if you find yourself selecting date unknown, I would pause and think, wait a minute, do I have what I need in terms of supporting documentation to be answering this question as a yes? I'm going to say no for now. Next one gets into inpatient stays for a mental health or physical health illness. I want to note that these are not ER visits. ER visits do not, unfortunately, go anywhere on HML. This is only for folks who have been admitted and subsequently discharged from a hospital setting. So it combines both mental and physical in the one question. So just be careful. There's a lot of options here. So it's going to ask, yes, they were discharged from a mental illness stay versus a physical health stay, or no, they weren't discharged from any. Again, the last two say date unknown. If you are selecting that, I would pause and think, why don't I know this date? I should have some documentation to support this uploaded to CareManager. So I should not be picking date unknown here. So I'll say yes to this one. And let's say this was sometime a while ago. This was, back in June of last year. Same thing here, but with substance use. So if he was discharged from an inpatient substance use stay, I would select yes and put the date in, or no. 8 is a tricky one. This gets into not just active use of substances, but a documented functional impairment based on that use. It's a 3-part question, and you have to have a positive response to all 3. My recommendation is to start with the last one, because this is the hardest one to sort of satisfy. This is basically saying that we have documentation that this member's addiction is diagnosed in a severe disease state. That's kind of the key word we're looking for here, is that it is severe. It is not just that they use, but that it is severe enough that it's impacting their daily lives and they've been diagnosed as such. So if you don't have documentation of that severe disease state, this entire question is going to be a no. Again, there's options for each of these. It's if they're using, and then if their use is kind of impacting their day-to-day life, and then again, that documentation of a severe disease state. So if you can't say yes to all 3 of these, this is the whole question is going to be a no. For those of you who serve AOT, this is where we indicate if they're in the AOT population. So question 9 here is just, are they AOT? That's it. I'm going to say yes for the sake of today. And then I'm going to be asked, did I meet the requirements of AOT? So did I do my 4 face-to-face core services? If I did, I would say yes. If I didn't, I'll say no. Even if you did 1 core service, you're still going to indicate that up here in question 1. This is just asking if you got in your 4 face-to-face. 10 and 11 are always going to be no. We don't serve ACT and we don't serve Adult Home Plus, so you can always put no to those. And then 12 gets into the Health Home Plus population, though again, the first question is just asking, are they in the Health Home Plus population or being served at that level of care at this time? If I say yes, then I'm going to get, similar to the AOT, another question about whether or not I met the requirements, which would be the 4 core services, 2 of which are face-to-face with the member. So I can say, if I say no, that's it. But if I say yes, I have to pick also the qualifiers. So be very careful here because it does have HIV and SMI in here. So you want to think, first of all, which one am I looking for? HIV Health Home Plus or SMI Health Home Plus? And then within that section, pick the qualifying conditions. What you pick here should match what is on your Health Home Plus eligibility checklist that is uploaded to CareManager. I'm going to change AOT to no for here because it wouldn't make any sense. Someone wouldn't be in AOT and Health Home Plus. They are either in one or the other. Foster care, most of you can just select NA if your member is over 21. If they're not, you can select no. And then for the last question, the UAS complexity high risk assessment, we will always put unknown for that. So once you've completed everything and you're fairly certain this is accurate and true to the best of your ability, you have all of your supporting documentation uploaded for any yeses here. I just go ahead and attest that I have reviewed this, that it's accurate, and then I can go ahead and save and close. Now I will see my first HML assessment done here for the month of June. Now, when you go to do your next one, we're in the month of July. I'm going to do the same thing. I'm going to look for my HML billing questionnaire. When it populates, you'll see it populates automatically to July. And I'll have to fill in the status here, draft or final. And then all of my questions, 2 through 14 are already filled in for me. So really what I need to do is just go in and update this. So let's say, yes, I have a core service. I'm going to pick my date of core service in July. Conditions probably haven't changed. The member's probably still HIV positive. The homelessness, this is where you want to be careful and look at these dates. Is it past 6 months? And if it is past 6 months, I need to take this off of HML and change it to a no. If they've been incarcerated in the last month and been released, I want to note that here. Now we're in July. This is past a year. So I need to make sure I change this to a no. They were not discharged from an inpatient stay within the last year. There is no functionality in CareManager that is going to check that for you. And there's no logic that's going to say, hey, you're trying to save an HML with a date that's past due. So you need to be careful and make sure you're looking at these questions and answering them and updating them as appropriate. Same thing is going to be true with your Health Home Plus one. Maybe I didn't get in all my billables this month, then I need to make sure I change this to a no. Every month, I'm going to have to enter in the core service, which I did up here, and I'm going to have to check off that I've reviewed all this. And again, that means I've gone through and made sure my dates are all still within the proper ranges, and I don't need anything there's nothing I need to add to the assessment. Now I'm going to go and try and save and close this. And I got an error message. There are two reasons you will get an error message on your HML when you go to save. First, and in this case, it's because I don't have a billable note written for July. And I knew that, and I knew I was going to get the error here. But the CareManager is checking to make sure that if I say I did a billable service, that I actually have a billable note documented. The other error you might get is if your plan of care has not been updated in the last 12 months. State requirements are that plans of care be updated annually. And if your plan of care is out of compliance here, you will not be allowed to save your HML. So I'm just going to cancel all of this for now. But if I had written my note for July, I would be able to save it. And that is all that goes in to your HML assessments in CareManager.